Good morning, I'm Reg Woodley from CanCare. We're here to continue our series on the supportive care needs of patients. Today we have Ross with us, and Ross is going to share some of his insights and experiences. So Ross, can you tell us a little bit about, your background and what sort of...
Well, Reg, I came out of a hospital background just before I retired, and I'd been working with a lot of clients who were living with cancer before I did that. But for many hospital workers, including myself, sometimes it's actually quite difficult to work to the extent that you'd like with individual clients. So for me, working in CanCare gave me the opportunity to just concentrate on one or two clients and work with their needs. That was enormously interesting to me. That's why I got into it.
Right. But you had a bit of a background in social work too, didn't you? So
yes.
You did that at university? Or?
I'd been teaching for many years. I left teaching at 40, went back to social work, and then worked in the hospital system, including oncology at North Shore for about 15 years before I retired.
And so how long have you been a navigator with CanCare?
Well, I was trying to work that out the other day. I think it's a couple of years, Reg. Yes, it must be a couple of years now.
Right, okay. And in terms of the role, Ross, what have you found what have you enjoyed most about what you're doing?
I think one of the great things we're able to do as an organisation is work according to an individual person's needs. And it's hard for me to find the common theme with the clients that I've looked after. Of course, they all come from an experience of living with cancer, but their needs and who they are enormously different. That's really the attraction for me, that I won't know till I start who it is that I'm going to be working with, what their life and journey is like, and what may be the ways in which I can support them.
Right. So what sort of, in terms of some of the cases that you've had, what sort of impact, or what are some of the positives from the patient side of things? What have you seen in terms of the benefit for those people?
I remember particularly an older client, 92, 93, with a quite late diagnosis. The doctor was offering her radiotherapy. She wanted to do that radiotherapy, but was very nervous about the process, the practical process of getting to the hospital, coming into the hospital system and being treated and how to get out. The foundation worked with her, organised the transport, and I used to meet her at the door. Cancer treatment in radiotherapy often has delays, so she and I'd have coffee and we'd relax and talk. We'd spend a lot of time with each other, as very unusual for a person her age. She had 25 daily treatments, quite close spaced, and so for that intense period of time she had someone with her. I just enjoyed firstly her company, because she was a great coffee drinker, but more than else I found once she had developed some confidence, she was a great model of endurance and being able to do this, and she did it very well.
And do you do any volunteering with any other, in terms of some of your other roles? Do you, just going back to the volunteering?
Well, look, when I was in hospital, people often used to say to me, well, where did you learn some of these skills? And for me, many of the skills that I practiced in hospitals, I'd learned as a palliative care volunteer years before, of being able to be with people. Maybe the difference in a hospital is the ability not only to practice empathy and to work with the client, but in a busy environment like a hospital, being able to relax and just be in that moment. That's a skill I think that volunteers are offered in programs that they can just work with an individual for quite an extended period of time. Great experience for many people. It certainly is for me.
So it sounds as though you've got a great, you've got a lot out of being involved in the program, and it sounds as though in a lot of ways it's a sort of a win-win really for both you and the person that you're supporting. There's an element of personal reward in there that you're...
I'm not sure that I would speak for the client, but I would say that I get a lot out of the experience. I think for clients who find a cancer diagnosis a crisis in terms of themselves, in terms of their fears, I think working with someone who, at least on the surface, looks calm and collected is helpful. And I've learned an awful lot about people in the process. Many of our clients are remarkable people in themselves. And so I think that's what I get out of it. I think I have some skills to offer them, but I've learnt a lot, at least as much.